Personal and household services, PHS, are essential for the well-being of families and individuals. These services, including childcare, elderly care, cleaning, home repairs, and ICT support, transform households into workplaces, enhancing daily life and societal functioning. Despite their importance, the PHS sector faces poor working conditions and undervalued work, particularly in Central and Eastern Europe, where weak regulations and ineffective industrial relations hinder progress. To improve this situation, the PERHOUSE project, funded by the European Union, explores industrial relations to enhance working conditions and services in PHS across 12 Central and Eastern European countries: Bulgaria, Croatia, Czechia, Estonia, Hungary, Latvia, Lithuania, North Macedonia, Poland, Romania, Slovakia, and Slovenia. 6 project partners participated in PERHOUSE to address key research questions about the current state of PHS in CEE countries and the role of social dialogue in regulating and improving work patterns in this sector. The findings show that the PHS sector in CEE countries is diverse, with many informal jobs and a high share of female workers. Due to demographic shifts, demand for childcare and elderly care is rising. Family members provide a significant share of these services, and in some countries, the government provides subsidies for their household work. However, PHS workers face challenges related to professionalization, access to training and certification, and insufficient state regulation. An online survey on the demand for PHS in 12 CEE countries revealed that 76% of respondents used at least one PHS service in the last 5 years, mainly for small repairs and housekeeping. Time constraints and lack of skills were the main reasons for purchasing these services. Conversely, reasons for not purchasing PHS services included a preference for personal handling of home and family care, affordability, and lack of trust in strangers delivering the service. The survey also shows that people would be more encouraged to use PHS services if the service was of high quality and professional. Demand for PHS is thus driven by more factors than low prices or state subsidies. Furthermore, national social partners and other actors have identified challenges affecting the quality of PHS in Central and Eastern European countries. These include low public service investment, lack of social dialogue, low wages, and workforce shortages. To address these issues, national stakeholders from 12 CEE countries suggest improving regulation, ensuring compliance with standards, and subsidizing services to increase availability for those in need. Improvements in social dialogue in the PHS sector are also recommended. Detailed analyses in Czechia, Slovenia, Estonia, Poland, North Macedonia, and Slovakia revealed common challenges. Underdeveloped social dialogue frameworks impact the effectiveness of worker representation and negotiations. Disparities exist between the public and private sectors, with public sector workers generally better represented in social dialogue. There is a significant lack of trade union representation, especially in personal assistance and non-care services. Low union participation and weak collective bargaining power are prevalent in all studied countries. High levels of informality hinder systematic social dialogue, professionalization of workers, and protection of their rights. Governments and employers in some countries resist engaging in social dialogue, particularly in negotiating sector-wide improvements in working conditions. Based on collected data, including interviews and focus groups, the project partners suggest the following policy recommendations. In Czechia, formalizing informal PHS work arrangements is recommended. Slovenia might expand public PHS services to address undeclared work, strengthen trade union representation in privately provided services, and improve working conditions. Estonia might establish an organization for family caregivers, provide state-sponsored training, and ensure balanced social dialogue. For Poland, the consortium recommends simplifying the contractual rules, modernizing labor market institutions, and enhancing social dialogue to improve the conditions of PHS workers. Next to increased public service investments, North Macedonia requires targeted policies to address sector-specific challenges, such as the care drain due to demographic changes. Slovakia should expand training capacities for care workers and create a registry of professional carers to advance their professionalization and tackle unfair competition from undeclared workers. For more information, visit the project website